And welcome to this webinar on the standards of conduct, performance and ethics. Today I will be talking about the review that we've done and the revisions that we've made to these standards. And so I'll start with a brief introduction to the standards and the review, and then I will be going into some more detail about the changes that we've made and then I'll move on to our implementation period. I'll first of all talk about what the HCPC will be doing during the implementation period, and then I'll be moving on to what we expect from our registrants. I can see that a number of people have their hands up. So we are recording this webinar so that it can be available on the website after the webinar has finished. We've got a lot of people in the room today, and there were actually quite a lot of people who weren't able to sign up because we have oversubscribed. So we want to make sure that those people have access to this information, and that's why we're recording it. So I won't be turning on anybody's video or mics today for GDPR reasons, but we will be interacting with you on the Q&A and also on Slido as well. I'll give you the details of that in just a minute. So if you have any questions, please do pop them into the Q&A. There are moments in the presentation as I go through where you'll be able to ask. I'll come to the questions and I'll provide some answers. And as I say, we'll also have the Slido open for more comments and longer questions as well if it can't fit into the Q&A. So there are the details for the Slido. So in order to get to the Slido, you just need to go to slido.com and type in the number there. It's #3890701. And so we'll be using the Slido as we go through the presentation, asking some specific questions and for people's thoughts on some of the changes that we've made. So first of all, let's talk about the review that we started on the standards of conduct, performance and ethics. The review started in May 2022, and it's a really important review that we did because these standards are really imperative to the way that the HCPC works as a regulator and also to our registrants as well. They set out how registrants ought to behave, they outline what the public should expect from health and care professionals, and they help us at the HCPC to make decisions about the character of people who join our register, and they are used by us if someone raises a concern about a registrant's practice or when things go wrong. I do apologise for the admitting noise as I'm going through the presentation. I have tried to turn it off, but Teams is not cooperating with me. So in the interest of time, I'm just going to keep going. And I think as time goes on, that noise will calm down as people stay in the room. So our review to the standards of conduct, performance and ethics consisted of a pre-consultation survey and workshops with each stakeholder group. So those stakeholders included professional bodies, trade unions, registrants, service users, and I know I'm forgetting one, and employers as well. And also we conducted desk research, and we also had discussions with other regulators such as the General Medical Council and the Nursing Midwifery Council and other stakeholders like Greener NHS and the Office of the Chief Sustainability Officer. So drawing upon our pre-consultation work, we drafted proposed revisions and released these for public consultation in March of this year. We received 218 responses to the consultation, and 190 responses were from individuals and 28 responses were from organisations. Of the 190 individual responses, over 80% were from HCPC registered professionals. So that's 161 individual and HCPC registrants who responded to the consultation. So this consultation was specifically very, there was a lot of interest in it from registrants, and we really, really appreciate that. We also carried out 6 thematic workshops during the during the consultation, and we had over 200 participants who joined those workshops. And again, what we heard in those workshops was really invaluable from our respondents and participants, and we fed that into the proposals, into the final revisions that we made to the standards. So following the review, we have made changes to the standards. These changes are not an overhaul of the standards, so several things remain the same. First of all, there are still 10 standards. The headings of these standards remain the same, along with the structure and the purpose of the standards as well. What has changed is the detail of the standards, and that's what I'm going to go into now. So the revisions that we've made are under 5 key themes. They are equality, diversity and inclusion, communication, duty of candour, upskilling and training, managing health and disabilities in the workplace, and also we talked about sustainability as well in our consultation. We haven't made any changes in relation to sustainability. However, I will talk a little bit about sustainability and what we're going to be doing on that a little bit later on in the session. So many of these changes are about implementing more active language for registrants, making their responsibilities clearer and highlighting the importance of certain values, such as being open and honest and practicing safely and effectively. In addition to these changes, we've also made changes to our guidance on social media that sits alongside the standards. We are currently beginning to review the remaining pieces of guidance that sit under the standards, and we're working with our explanatory materials working group to design more explanatory materials for the standards. So, for example, that may be an easy read version of the standards as we have for the current standards, and also maybe some further guidance and things like that as well, and online materials. In response to our consultation question on sustainability, we have committed to creating a sustainable practice hub on the HCPC website. I'll go into a little bit more detail about some of those commitments later in the session. But let's first of all explore the key themes. And the changes that we made. So, equality, diversity and inclusion is the first theme that we'll look at today. Many of the changes we've made here are about making the language in our standards clearer and more active. The changes that we have made to Standard 1.3 ensure that service users are better supported by registrants to make informed decisions. Originally, the standard read, "You must encourage and help service users where appropriate to maintain their own health and well-being, and support them so they can make informed decisions." You can see the new Standard 1.3 on the slide, where we instead refer to empowering and enabling service users. Our changes to Standard 1.4 ensure that registrants understand that for consent to be valid, it must be voluntary and informed, and the person consenting must have the capacity to make the decision. Originally, the standard read, you must make sure that you have consent from service users or another appropriate authority before you provide care, treatment, or other services. Now, as you can see on the slide, we refer to valid consent, which is voluntary and informed, and also refer to ensuring that service users have capacity to make the decision in the new standard 1.4. The changes that we have made to this section of Standard 1 are all about challenging discrimination. So we've added a new standard 1.5, and that standard retains a simple duty to not discriminate, and that is by including the words treating people fairly, and referring to the impact of one's personal values, biases, and beliefs on the care and treatment or other services that a registrant may provide. For Standard 1.6, we have updated the language to make it more active. The changes to Standard 1.6 ensure that registrants are being asked to take action to ensure they are meeting equality, diversity, and inclusion commitments. Originally, the standard read, you must not discriminate against service users, carers, or colleagues by allowing your personal views to affect your professional relationships or the care, treatment, or other services that you provide. Now, as you can see on the screen, the standard refers to taking action and ensuring personal values, biases, and beliefs do not lead to discrimination or detrimentally impact care. Changes to Standard 1.7 provide registrants with clearer requirements to raise concerns about colleagues whom they think may be discriminating against service users, carers, or other colleagues. The standard previously read, you must challenge colleagues if you think that they have discriminated against or are discriminating against service users, carers, and colleagues. The revised standard instead refers to raising concerns and that registrants must follow relevant internal procedures in their workplace. In this next section of Standard 1, which is all about maintaining appropriate boundaries, we have added 4 new standards. Those are Standards 1.8 through to 1.11. Standard 1.8 introduces active language for registrants to consider the potential impact of their position of power and trust in social and personal settings. Similarly, Standard 1.9 introduces active language around setting professional boundaries, specifically requiring registrants to take action to set these boundaries with service users and/or carers and also colleagues. Standard 1.10 requires registrants to use appropriate methods of communication in their provision of care. The new Standard 1.11 makes it clear that registrants must ensure that any personal relationships between colleagues should not influence a registrant's professional decisions. Now, Standard 1.12 is an updated standard. It was previously Standard 1.7, and it read, you must keep your relationships with service users and carers professional. The revised standard refers to registrants not abusing their position, and it sets out specific sets of relationships that registrants should ensure are not founded upon an abuse of their power. For example, personal, sexual, emotional, or financial relationships. We've also added reference to colleagues in the standard. As I mentioned earlier, you'll notice that there are some key ways in which this standard has changed. So there's more active language, which is in line with the changes that we have made to the standards of proficiency. And this supports registrants to be autonomous and caring professionals. We've also made some changes specifically in response to consultation feedback. So, for example, following feedback that challenging colleagues, as stated in previous standard 1.6, could put registrants at risk of harm. Therefore, we changed the language to refer to raising concerns instead. We've also made updates around points of clarity. For example, in our original proposed standard 1.8, we have changed the wording from be aware to consider in the final revision, and that was following feedback in our consultation. Okay, so we're going to go to our first Slido. I'm happy to see that the Slido is open. And so just a reminder that you can join the Slido and leave your comments by going to slido.com and using the number 3890701 to log in. And I can see that my colleague Maheshi has also joined, so I'm just going to bring her on screen and she can introduce herself a little bit whilst we wait for everybody to.
Hi everyone, sorry my camera's a bit defective at the moment so you won't be able to see me, but I'm looking forward to the rest of the webinar and here on hand for any questions on the Q&A as well, and look forward to the rest of the session. I am Ashley De Silva, Policy Officer for the HCPC.
Awesome, thank you, Maheshi. So I can see some things coming into the Slido, which is awesome, and also some questions in the chat. So, okay, I think, yeah, so here's one question is, will these slides be shared with us after the webinar? So the recording will be available on the HCPC website. That will include the slides, and I can also upload these slides as well, actually, to the HCPC website and the resources that we have there on the revised standards as well. So I will do that too. And this is great. Lots of people participating in the Slido. Thank you so much for all your comments. And yeah, it's great to know that people think that these changes will be beneficial to service users. And yeah, I'm so glad that I've seen a lot of people talking about having greater confidence to challenge different behaviours, and that's really awesome. I'm assuming that comes from some of the specifically changes to 1.6, as well as some other changes as well, I imagine. Great, such good feedback. Thank you so much. And, also great to hear about, so I can see someone saying they'll upgrade their practice accordingly. It would be also great to hear about different ways in which people think they might put these changes into practice, the things that might be required and things like that. Yeah, so when we ask, what do these changes mean for your practice? What 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 will you be doing? What kind of things do you think you might do? And again, yeah, super grateful to hear that people have positive feedback around these particular changes. Awesome. And I can see someone saying equity and addressing own bias is really key. Taking action to address inequity is important. Exactly. And that is what we heard in our consultation, in our pre-consultation work as well. And it's what we're seeing across healthcare regulation, that people are taking equality, diversity and inclusion a lot more seriously, and are really thinking about how to put it into practice as well, and how to champion equality, diversity and inclusion. So that's great. Okay, so the Slido will remain open, I think, as I move on, but we will be also be coming back to the Slido anyway, in relation to the other themes that we'll talk about today. Just going to quickly check on the Q&A. Can't see any extra questions there. Irina, I hope your problems with the sound have resolved. I hope it is just you and it's not everybody. Yeah, let's move on to the next one. Thank you everybody for your comments on the Slido. So next, we're going to discuss our theme on communication with colleagues, service users and carers. This mostly relates to Standard 2. So under Communicate with Service Users and Carers, we have made changes to Standard 2.4 to better communicate statutory principles to meet service users and their carers' communication needs. So originally, 2.4 read, you must make sure that where possible, arrangements are made to meet service users and carers' language and communication needs. We now reference taking all practicable steps to meet service user needs. We've also added new standard 2.5. This makes it clear that in all communication with service users and carers, registrants must communicate responsibly. So it's not where you say it, what method of communication you're using, it's about what you say. Under the Work with Colleagues section of Standard 2, we've added a new Standard 2.8. It requires registrants to treat colleagues in a professional manner, showing them respect and consideration. We've also added Standard 2.9. Similar to 2.5, this new standard states that registrants must use all forms of communication appropriately and responsibly when communicating with colleagues. So it's important that we make sure that these standards go across the different people that registrants will be working with and providing services to. So we've added that reference to colleagues as well in standard 2.9. So again, it's not about where you say something, it is about what you say. Our standards on social media and networking sites have expanded considerably as a result of our review. Standard 2.10 is our previous standard 2.7 on social media. That read, you must use all forms of communication appropriately and responsibly, including social media and networking sites. Now that may sound familiar. As you can see from the previous slide, we added that into our other sections of Standard 2. So now Standard 2.10, specifically relating to social media and networking sites, is more specific. It states that registrants must use media sharing networks and social networking sites responsibly. We have added two new standards to this section, Standard 2.11 and Standard 2.12. The new Standard 2.11 tackles the increased occurrence of misinformation on social media. It ensures that registrants understand that they have a responsibility to check the accuracy of the information that they share. The new Standard 2.12 ensures that registrants' responsibilities to maintain professional boundaries and protect service user information on social media is stated clearly. Much of our changes about communicating with service users, carers and colleagues originated from stakeholder feedback throughout the review. So, for example, the concern that survey respondents and workshop participants in the pre-consultation work that we did had for how registrants treat colleagues is represented in new Standard 2.8, specifically stating how we expect registrants to interact with their colleagues, and that is professionally and respectfully. We also responded to stakeholder concerns about misinformation on social media and online in generally. And so we did that by adding a specific standard intended to tackle misinformation. Okay, everybody. So we're going back to the Slido. And again, I'll just remind you, you can go to slido.com and the number is just there on the screen, 3890701. So please do share your comments about these changes and what these changes mean to you. And also please ask any questions as well. You can ask questions in the Q&A. You can also ask questions in the Slido as well, whatever suits you best. I've got both available to me, so if you do have a question, I can answer it. I can see lots of people typing already, which is great. Always good to have everybody engaged. Great. I'm so glad that people agree that this is an important addition. Social media is so widely used nowadays by so many different people, and audiences are so large. It is so important, I think, that registrants understand how and are supported as well to know how best to use social media in a way that is protecting the public. Which is what HCPC here is here to do. And I'm also very happy to hear about um, people liking the new guidance as well. I think I've gone back a bit. Sorry, excuse me. Oh, no, I've just gone forward. Sorry about that. I touched my screen and yep, okay. So I got a question here. Does the social media use relate to personal social media as well, or if you work in a different capacity, where do we draw the line? So we've got a lot of information about that on our guidance on social media. So as I said earlier, we have updated the standards and we've also updated the guidance on social media, partly because the standards that we have on social media have expanded so greatly. So it was really important that we update our guidance on social media at the same time. And so there we've talked about personal and professional use of social media. And I think the main thing to remember is it really isn't about where you're saying something, it's about what you're saying. So if you're on a personal account, and it's open, and that's like, for example, that's open to the public, and you're talking as a professional, your profession is very clear. It's important that you're careful about what you say, that you think carefully about the standards and your obligations, and that you think about that sort of coming back to that protection of the public, coming back to respect and consideration, and just following the standards really. But yeah, so I hope that answers your question. But if you need any more clarification, please do read the guidance on social media. It does go into a bit more detail as well about what you'll need to be doing. And also it's great, someone's mentioned in the Slido that different NHS trusts have different rules re social media, and yeah, that is really important to recognise, because what we do want people to do, registrants, is to follow their internal procedures and rules when it comes to social media use as well. So one thing to remember about the standards of conduct, performance and ethics is that these are a high level framework for the behaviour that we expect of registrants. So they align with, for example, your employer rules around social media, but obviously your employer rules around social media will go into a lot more detail about what to do, what to post, what not to post, and things like that. Great. Okay, awesome. Thank you everybody for your comments so far. I'm going to move on. We're already halfway through. We're already half an hour through the session, so I don't want to lose time. Okay, great. So the next theme that we're looking at is duty of candor. This is all about what we expect registrants to do when things go wrong, and that's to be open and honest. So we have made changes to Standard 8.1 that make the process that registrants must follow clearer and better aligned with HCPC online materials on the duty of candour. We've also added wording to reflect the variety of contexts that registrants work in. For example, where registrants do not have access to a service user or carer to inform them that something has gone wrong, they are expected to inform their lead clinician of what has gone wrong instead. We have also removed apologising from Standard 8.1 and we've set it out as a separate standard, and that's Standard 8.2. This highlights the centrality of apologising when things go wrong, and it recognises apologising as a professional duty. This, again, it better aligns with our guidance on this issue. Originally, Standard 8.1 read, you must be open and honest when something has gone wrong with the care, treatment or other services that you provide by informing service users or where appropriate their carers that something has gone wrong, apologising, taking action to put matters right if possible, and making sure that service users or, where appropriate, their carers receive a full and prompt explanation of what has happened and any likely effects. So you can see on the slide here those additions that we've made to the standard that make it a little bit clearer and also allow for those contexts in which registrants may not have access to service users or their carers. So the changes that we made to this standard are mostly originated from stakeholder feedback. So that includes to make Standard 8.1 clearer and to better align the standard with our online materials. We also heard from some registrants that they wouldn't have direct access to service users and carers, and so that's why we added in that bit about lead clinicians to the standard as well. Okay, so coming on to our Slido again, please do add your comments. It's important that we hear from you. And yeah, it's been great so far to hear what you have to say, and also do keep asking questions as well. I'm going to check out the Q&A, see if there's anything there. Okay, this is a really great question. Does apologising signify you have done wrong and perhaps need to only come after investigation? So we have additional guidance that talks about liability and apologising. So HCPC and the law state that apologising does not mean that you are liable in any way. It doesn't, it is simply an important part of when things have gone wrong, of acknowledging that things have gone wrong. And our work with service users as well during the review has talked about how we've been taught, those service users that we talk to, they talk to us about how important it is for them to receive an apology when something has gone wrong, and how it helps to move on from that incident. So I'm just checking out the Slido. Excellent. I'm glad that people are appreciating the addition of the apology standard, and also that yeah, and also appreciating the addition of the lead clinician to standard 8.1 as well. Yeah, exactly. This is a really good point here. So someone said, really pleased to see that apologising is a standard. Often patients just want to understand what has happened and to ensure that people learn from it to stop it happening again. And yeah, that's exactly what we heard when we talked to service users. Yeah, and I also appreciate this person's comment that sometimes the perception from a service user of what has gone wrong can be and whether something has actually gone wrong can be difficult to negotiate. And certainly, I think it is important to think about actually what has gone wrong, if there is something that's gone wrong. Do you know what I mean? Um, and to be very clear as well about the things that have gone wrong to help untie that sort of difficulty. Yeah. And again, someone said here that apologizing often helps to calm the situation. And yeah, and just acknowledging people's feelings as well. Um, okay, cool. So this is an interesting question here. How do you differentiate between the wrong done by an individual professional and or done by the organization and who needs to apologize? So of course, here at the HCPC, we only regulate registrants. So for us, it really is important that registrants apologise when they are involved in something that has gone wrong. That may be an organisational issue. It may be something much wider, and the organisation may decide later on to apologise, but it's important that individuals involved apologise. Um, and part of the reason for these standards is of course to set out how we expect registrants to behave, but registrants can also use these standards to support themselves and to support the decisions that they're making as well. So someone is talking about in the Slido is talking about when employers don't feel that you ought to apologise. And well, your standards ask that where they require you to apologise where something has gone wrong. And so you can use these standards when you're in a situation like that to say, actually, this is my professional duty under standard 8.2. I hope that that helps. Okay, thanks everybody for your comments so far. I'm going to move on to the next theme, which is upskilling and training responsibilities. So the changes that we have made regarding upskilling and training relates to Standard 3, and that is really all about your scope of practice. So the changes that we've made to Standard 3.1 make the relationship between safe and effective practice and scope of practice very clear. Originally, the standard read, you must keep within your scope of practice by only practicing in the areas you have appropriate knowledge, skills and experience for. The standard now includes specific reference to safely and effectively. We also added a new standard, that's standard 3.2, and that's to ensure that registrants understand the actions that they can take to widen their scope of practice. This standard references undertaking additional training to update one's skills, knowledge and experience. And then standard 3.3 is updated from previous wording. You must refer a service user to another practitioner if the care, treatment or other services they provide, they need, are beyond your scope of practice. We've expanded this to ascertain that this person must hold the appropriate knowledge, skills and experience to meet the needs of the service user safely and effectively. It thereby specifically sets out that they must hold the appropriate scope of practice to provide the service being referred. So the changes that we've made to Standard 3 are, as I said, they're mostly related to scope of practice. And we get a lot of questions about scope of practice from registrants, particularly on what they need to do to widen their scope of practice. So the changes that we made set out to make this clear and to help registrants to understand the centrality of safety and effectiveness when it comes to their scope of practice. It really is all about safety and effectiveness. Okay, everyone, we're going back to the Slido to hear how what these changes mean to you. And I'll take a look at the Q&A again. Haven't got any further questions in the Q&A yet, and I can see people are typing in the Slido, so that's great. Got quite a lot of people typing, so looking forward to seeing that. Okay, so I've got a question here. Should we have a minimum clinical hours? So again, just to remind you that the standards of conduct, performance, and ethics are really a high-level framework. So we don't tell you specifically these are the number of clinical hours you need to become a registrant or anything like that. That isn't what the standards of conduct, performance, and ethics are here to do. They are here to simply set out how we expect registrants to behave and what service users can expect from their health and care professional. And they also help us as well when we're making decisions about who joins the register and when things go wrong as well, what we need to do. So there's no specific standard on the number of clinical hours you need to complete. Okay, cool. So some people are in the chat are referring to some difficulties they may have with meeting the standard. So particularly like in terms of referring on to people within their trust and things like that. It's very helpful for us to hear these kinds of issues as they come up. So later on, I will talk about this in a bit, but later on in the implementation period, we will be doing more workshops, and then we'll go into each theme in detail. And that'll be an opportunity for us to workshop about what registrants can do to put these standards into practice and the different challenges that people get in their workplaces as well. Because it is, realistically, it is challenging to put these things into practice, I think, and especially in a lot of workplaces that are under-resourced and that are where you're all very, very busy as well. A lot of people talking about in the Slido chat, there's a lot of people talking about the pressure to complete tasks, whether you have full training or not. And I think that's a really important point. And I want to come back to the fact that these standards are here to support you as well. So where someone is asking you to carry out a task that you have no experience, knowledge, or skills in, you can use these standards to support you in making the decision not to carry out that task. I know that is immensely challenging, but that is why that's also what you can do with these standards. They can help to support you in challenging situations like that. Because realistically, again, these standards are all about public protection. They are all about making sure that you are practicing in a safe and effective way and not putting anyone at risk of harm. I'm just going to check the Q&A before we move on. A lot of comments coming through in the Slido, which is really great. Okay, so an interesting one. Some staff feel that if they significantly widen their scope of practice, then they should have their job rebranded. What is the HCPC guidance on that? So we don't have specific guidance on that. You can, and so I think you can widen your scope of practice, and also I think but by carrying out different training and to enhance your knowledge, skills, and experience. And I think that, since COVID-19, a lot of registrants have been doing that. There are more and more different tasks that people carry out throughout their work, throughout their work and their practice. And I think it's important as well to include the standards of proficiency into this as well. So it's important that we think about that when we're thinking about what profession we are. So obviously the standards of proficiency set out the standards that you must meet at the time of registering. If you widened your scope of practice to the extent that you were a different profession, sure. Um, I don't think that that's likely to happen by accident. But yeah, we don't have any specific guidance on that, but what the standards here talk about is really making sure that you do get extra training where you need it, and that if you want to carry out a task that you don't have the knowledge, skills, and experience for, find the training to get those things. And that is how you widen your scope of practice. Okay, great. I can't see any more questions, so I'm going to move on to our final theme for the session, and then we'll talk a little bit about sustainability and the implementation period. So the final theme of the changes that we've made to the standards is managing existing health conditions and disabilities in the workplace. We've added a new standard 6.3 to make it clear that a registrant's responsibilities are to actively assess the impact that their health has on their practice. Following consultation, we added or asking an appropriate health and care professional to assess to standard 6.3. So you can see that wording there on the screen. We've also added that in the circumstances that a registrant isn't sure of their ability to make an assessment themselves, they can refer to another health and care practitioner to make their health assessment on their behalf. Standard 6.4 is updated from our previous standard 6.3, and that read, you must make changes to how you practice or stop practicing if your physical or mental health may affect your performance or judgment or put others at risk for any other reason. It sets out, so the new standard sets out that a registrant is responsible for ensuring that adjustments are made to their practice to make it safe and effective. So again, it comes back to the centrality of safe and effective practice. And it also makes clear that if one's physical or mental health is detrimentally impacting one's practice, it's not possible to make those adjustments to make it safe and effective, that registrant must stop practicing. So we made these changes following feedback from some disabled registrants that the previous standard 6.3 could sometimes make their registration more laborious and also created confusion about when they should refer themselves to the HCPC. In response to a concern about registrant ability to assess their own health, we also made the addition to Standard 6.3 that a registrant can refer to another health and care professional if they're unsure of their ability to make an assessment of their own. So, for example, if you're just not quite sure if your health is impacting your practice. So that was a conversation that we talked about quite a lot in our webinar on that focused on this particular topic, managing health and disabilities in the workplace. And so we talked about the difficulty that you can have, especially with, like, for example, like mental health conditions, to recognise the impact that they're having. Excuse me. Okay, so we're coming back to the Slido again. We want to hear from you about what these changes mean to you. Checking out the Q&A as well on Teams. I can't see any questions coming through. But I can see people typing in the Slido, so that is great. I'm going to wait a couple of more seconds to see what people are saying. And just a reminder, you can join our Slido at slido.com using the number 3890701. Somebody has said, I didn't respond to their question, so please do state your question again. And I will try and answer it to my best ability. Or if you want, you can add it to the Q&A as well. The Slido does go quite quick, so I might have just missed it. Stop practicing, as in take time off sick or leave the profession altogether. It really depends on the circumstance. Again, reminding you that these standards are a framework, a high-level framework, so they don't go into the specific things that you need to do and do this in this circumstance and things like that. They're very much a high-level framework of behaviour. So what is really important about it is about making care safe and effective. So any services that you're providing, they do need to be done, they need to be provided in a safe and effective way. And so, for example, you may have a health condition that has ebbs and flows, and that one may go into a period of time in which that health condition worsens and really detrimentally impacts one's ability to practice, and there's no way to make adjustments to make one's practice safe and effective. And in that circumstance, maybe one would need to stop practicing for a period of time in which in which the health condition has worsened, and then can come back to practicing when their practice is no longer being detrimentally impacted. Again, it's that real focus on making adjustments, and also to make those adjustments, the purpose of those adjustments is really to make it safe and effective for you to work. So just going through the Slido a little bit. Okay, so I think this raises an important point. These are particularly difficult to unpick, as could be confused with different thoughts/reasons about raising issues about others. I am aware of one such case, a non-visible illness that has led to negative perceptions from colleagues. But this person does also say that they think that these are an important area to raise and to consider. And I think that in that circumstance, we really need to look at the standards as a whole. So when we're thinking about someone's health condition or someone's disability, we must also ensure that we're doing that in a respectful, considerate, and professional manner, and in line with equality, diversity, and inclusion commitments. So, yeah, I think it's so 6.3 and 6.4 really don't stand on their own. They stand together with all the other standards as well, and one's workplace should not at any point become hostile because one has a health condition or a disability, and certainly we would not expect anybody to use 6.3 or 6.4 in that way. Okay, cool. So this is I'm going to just say thank you to this person for sharing. They've shared their experience of being diagnosed with ADHD, and they've realized that that's caused them a lot of challenges with understanding verbal communication and executive function, which can cause anxiety. And this person, they've taken the action to request support from their occupational health team and access to work. And um, and they are very proactive in supporting them to make adjustments and remain effective in work. And so this person has also said that they think there needs to be training and understanding for managers and colleagues. Yeah, so thank you so much to that person for sharing their experience. I'm very glad to hear that the services that you relied upon to make those adjustments for yourself were helpful and proactive. It's so good to hear. I think in the circumstance where one's employer is not or is not providing that, again, use these standards to advocate for yourself and what you need, and to advocate for your service users as well. Because at the end of the day, 6.3 and 6.4 are all about making sure that one's practice and the services that you're providing are safe and effective for service users. Okay, so, and someone's asked as well, how does this support reasonable adjustments due to protected characteristics such as a long-term disability? And that's the exact kind of adjustment that we're talking about. You know, if it's important that people with health conditions and disabilities receive adjustments that help them and support them to practice in a way that is safe and effective. And that includes making reasonable adjustments so that a so that a registrant can do that. I'm not quite sure about what this question is asking. If an employer is not providing you with up to the mark facilitation and unethically, you have to refer to a nominal patient to somewhere else. So who will be responsible and who will make this more precise? I'm not sure what you're asking. I think I'll come back to the idea to the standards on referring your service user to someone else if their needs cannot be met by yourself. That standard that we talked about earlier on in standard 3. I would follow that standard. If I haven't answered your question, please do put it back in the chat or put it in the Q&A. I'm going to move on now because Slido's slowing down and we need to move on because we're going to be running out of time. We've got half an hour to go. But yeah, if I didn't answer that last question, please do put it in the Q&A so I can have another look. Okay, so sustainability. This is this is an area that we discussed in our consultation. We asked a question about whether people wanted to see a standard on sustainability in the future. And we got a lot of responses in relation to sustainability. It was quite impressive how engaged people were. And those responses were positive and also cautious and also quite worried. So it really varied the responses that we got. And you can read more about the responses that we got on sustainability in our consultation outcome document. I will talk about that again in a little bit. And from the feedback that we received during the consultation on sustainability, we have not added a new standard on sustainability or made any specific changes that relate to practicing sustainably. However, we have committed to reviewing sustainability as part of our Standards of Education and Training review, which is due to take place in 2024. We will also be creating an area of the HCPC website that discusses practicing sustainably. And that's a Green Practice Hub. So that Green Practice Hub will include information about what sustainability is, information about why sustainability matters in health and care, resources on where to find out more information on sustainability. We'll also talk about different ideas for practicing in a more sustainable way as well. And so there'll be a lot of information, hopefully helping people to understand sustainability better where they don't already know about it, and supporting people to make the link between health and care and sustainability. And then also for those registrants who have a real who already have a commitment to sustainability and who have a lot of knowledge about it and are interested in practicing more sustainably, there'll be resources for them too. So I just want to take a minute here to think about how one might use the Sustainable Practice Hub. And this is really just an opportunity for me to get some feedback whilst I'm drafting the materials for the Sustainability Hub. So yeah, what do you think you'll be using the Sustainable Practice Hub for? And if will you use it? Um, yeah, and are you excited about the Sustainable Practice Hub? I don't know. I can see people typing on the Slido. I'm going to check in the Q&A for any further questions. Can't see any questions there. And Maheshi, do you want to join us again?
Yes. Hi, Rosemary. I think we've
Hi,
got two
Maheshi.
questions in on the Q&A that I can see. And oh, I think it's just disappeared. But I saw one on sustainability. Let me have a look again.
I can't see any on the Q&A.
Oh, I can see. So it's here. So it says, it's really important that we actually, it's not a question, it's a comment. So it's really important that we embed sustainability in pre-registration programs. So HCPC support is vital, which is always great to know.
Yeah, that
Um,
is, and that really aligns with what we're going to be doing next, when we look at the standards of education and training review, for sure. So yeah, that's helpful to hear.
yeah.
Okay, cool. Will it provide details of sustainable procurement and waste management? It certainly can. I can have a look at that for sure. I think that will differ across different workplaces though, but I can certainly find some different ideas and add those resources to the Sustainable Practice Hub. Any ideas for what people want to see on the Sustainable Practice Hub is really important. Like,
Yeah, and I think it's also okay to be unclear or not sure as well. And I think it's why it's useful to have these webinars as well to kind of bounce these ideas off one another and get a clearer picture of what we really want as well.
yeah, definitely. And I think this is a very good point that there will be a different impact for different professions. So, what sustainability looks like, what sustainable practice looks like, is going to really differ across the 15 different professions for sure. And not even that, just different workplaces. Even if you're in the same profession as somebody, actually, sustainable practice, I think, can look very different, depending on the context that you're working within. But yeah, I'm really, really glad to hear that people are interested. And
I
someone's
really like
asking how,
the
yeah, sorry,
comment.
go ahead, Maheshi.
Yeah, I was just going to say I really like the comment on everyone should be working sustainably and we all have a duty of care to future generations to do this. Yeah.
Exactly. And that's something that we'll talk about as well in the resources. And actually, we got a lot of resources through the consultation, people sharing a lot of resources with us. So that was also very cool. And I'll try and include some of those resources on the Sustainable Practice Hub as well. Someone asking to see case studies and examples of worldwide sustainable practices. How can we maintain infection control measures but be more planet friendly so it is implementable? It's a really good question. And yeah, certainly we'll be definitely adding case studies to the practice hub for sure. I think one of the key ways to really learn is to actually just look at a case study and how someone else has put something into practice.
Absolutely. And we've got, could it provide information on how to set up local sustainability focus groups as well? So could it provide information on how to set up local sustainability focus groups?
Sure. It can definitely provide some information about encouraging people to set up focus groups. I'm not sure. I think that it might be a little bit too detailed to talk about, to specifically give instructions on how to set those focus groups up. Again, like across 15 different professions working across the UK, in different contexts and workplaces. I think setting up a focus group is going to be really different across all of those things. But certainly we can look at if there's any examples of people setting up focus groups on sustainability, and include those in the practice hub as well. And yeah, I think, if you have any more ideas, very happy to hear them. So, just get in touch. You can chat to us at the policy, you can email the policy team, and talk to us about sustainability. Those emails will come to myself and Maheshi, and yeah, and we'll be happy to talk to you about them, to hear your ideas and your views. One of the main things about this review has been, and our future reviews as well, is about keeping the conversation going. So just making sure that these workshops, they're not just a one-time thing. They keep the conversation going. We'll be talking to you again later on in the year, later on in the new year, about all of these themes, and doing more workshops, hearing from you again. We're also, again, we're available on email and things like that as well. So yeah, we want to keep hearing from registrants about these standards and about our other standards as well. Okay, so I am going to. That's a good question, actually, that's just come in. What are the goals of global health as a HCPC registrant? So we haven't talked about global health in the standards of conduct, performance and ethics. We are very much focused on a UK context, on the context that our registrants are working within. And yeah, so I think that's a really interesting question to ruminate on. But yeah, so I think I'm going to have to take that one away and think about that some more. But thank you very much for that question. Okay, thanks everybody for your ideas. We have got those all written down on the Slido, and so we will keep thinking. We'll keep thinking about sustainability and thinking about our what materials we'll be putting on our Sustainable Practice Hub. So I want to talk now about our implementation period. So the standards of conduct, performance and ethics come into effect in September 2024. And up until that point, that is the period of time that we're calling our implementation period. For us, our implementation period is all about ensuring all of our stakeholders understand the revisions to the standards and that they know their obligations to implement them as well. So during this period of time, we will be carrying out a range of training activities through workshops with our external and internal stakeholders. We will also be reviewing the guidance that sits alongside the standards, such as our guidance on confidentiality and the online materials that explain the standards as well. And we will be developing explanatory materials to ensure that the standards are accessible to a range of different readers. Our first round of external workshops are taking place currently. This is the one of them. Yeah, this is our first public webinar, and you can visit the HCPC website to sign up for further webinars, and please do encourage others who may be interested to join as well. So we've got our webinar for students next week on Monday. And that's a really important one because all of our students who enter the register next year from September 2024, they will be expected to apply the revised standards. So it's important that we reach them and that we give them an opportunity to understand and learn about the revisions that we've made. We've also got a webinar for employers on the 21st of November. So please do go back to your employers, let them know that we are hosting a webinar for them to understand the revisions that we've made and to understand the different obligations that you guys have to meet the standards. Okay, so we've got another opportunity here to ask some questions for us, particularly on the implementation period and what we'll be doing. I did mention earlier as well that we'll be doing some workshops later in the new year. And those workshops will be thematic workshops. So they'll be looking at equality, diversity, inclusion, communication, upskilling and training, duty of candour, managing health and disabilities in the workplace, all separately, to really go into detail about the changes that have been made, and to hear questions from you about how to apply those standards as well. Yeah, sure. So the link, can we share the link? I haven't got the chat open, so I'm actually not sure about how to share the link.
I think we might need to just attach it with an email with the slides after. So not to worry, everyone. We'll just attach the links to an email for everyone to see.
Thank you, Maheshi. So there you go. You've heard it from Maheshi. We will be sending out the slides and some links to everyone in attendance today. And yeah, so thank you very much. The workshops that we'll be doing in the new year, they will be online as well. And someone's asked about specific updated standard 13.36. So that is a standard of proficiency. I'm not sure if we have any future, I don't know what future dates we have for webinars on the standards of proficiency. Those changes have come into effect now. But if you have any specific question on the standards of proficiency, please do just get in touch with the policy team and we can look at that question for you. Again, just email us. And also check out the web pages as well on the standards of proficiency and the changes that we've made. We've got a lot of information there about what the different standards are and also about what the revisions mean as well. Oh, okay, this is a really great question. Can we professionals start applying these standards even though they are in the implementation stages? Yeah, definitely. These standards are, because we haven't, these changes aren't an overhaul of the standards of conduct, performance and ethics. So you definitely can start to implement them now, and you can start to apply them to your practice as well now. You're not measured against them now. It will only be in September 2024 that these will come into effect. Okay, I've got another question I'm not quite sure I understand. So yeah, please do come into the Q&A on Teams and let me know what you mean. So what do HCPC elites do for their registrants to get hired and move on? So I think you mean like how do we support registrants to move through their career? And yeah, I think check out the HCPC website. I couldn't speak to things that we specifically do. I work on the standards of conduct, performance, and ethics, and that's what I'm here to talk to you about today. But yeah, we do have a lot of information on the HCPC website, and yeah, and about the different support that we offer our registrants as well. Thank you so much, everybody. Thanking me and Maheshi for a helpful and engagingly presented webinar. I'm so glad that you all enjoyed it. I'm actually not finished yet. We do have a couple more slides to go, and we've got just about 10 minutes to do that. So I'm going to move on. Oh, I'm sorry you don't have access to the Q&A. Someone has mentioned in the chat, but please do leave your question here on Slido if you can't access the Q&A on Teams. So just before we wrap up, I want to make clear what we expect from registrants in the implementation phase, and what you can do to prepare yourselves. So when the standards come into effect on the 1st of September 2024, we do expect registrants to be able to apply these revised standards. So this includes anyone who is entering the register for the first time, and we expect those new registrants to undertake CPD and develop their skills and knowledge of the new standards. Again, we have a number of workshops and resources that registrants can engage with to prepare themselves. So these are our documents and resources that we have available on the revised standards. We've got the key documents, the revised standards themselves, and the revised guidance on social media as well. And then we also have information about how these changes were made. So it really goes into in detail about the review, especially our consultation. Through our consultation outcome document, it talks about what we heard from our consultation respondents and the different decisions that we made as a result. We've also got our equality impact assessment that is available online, and that goes into how we consider different protected characteristics when we were making these revisions. There's also a main news story on the HCPC website that kind of just provides a summary of the review. And then there is the key changes document, and that is really, really helpful to understand the changes that we've made here. It actually lists the changes against the previous ones, against the previous standards. And just one more opportunity to ask some questions.
I think we have some in the Q&A popping up there, Rosemary. I can see the Slido. A few people are typing.
Yeah. And someone's asked in the Q&A, can we please include workshops in the future during evening times rather than solely in the middle of the day? Yes, certainly. We do know that when it comes to registrants and the public, people do prefer to have webinars in the evening rather than the middle of the day. We know you guys are working hard in the middle of the day, so we wouldn't ask you to yeah, we don't generally like to do workshops in the middle of the day. And so we've got another question where I'm going to direct you to the website, how to renew HCPC registration. You can find information about renewals for different professions on the HCPC website, so please do go there. It's fairly easy to find as well. Okay, cool. So got a couple of questions about the recording. So the recording and the slides the recording will be on the HCPC website. We'll provide links in an email to the links that we've talked about here, so to those documents. And also we will circulate the slides to attendees via email as well. So I think that answers everybody's questions. If you have any further questions, you can get in contact with us at these different email addresses, depending on what your question relates to. So if, for example, your question relates to the standards of conduct, performance and ethics, or the standards of proficiency, you can get in contact with the policy department. That's Maheshi and myself and our colleagues. And you can also talk to our professional liaison team. We've got the registration email address there, and also our FTP email address as well. And don't forget to keep a lookout on our socials for updates and events that are coming up and things like that. We always put things on our LinkedIn and things to keep people involved and updated. Okay, and that brings us to an end with 5 minutes to spare. I hope you all go and enjoy your evenings. Thank you so, so much for joining us today. We really appreciate it. And yeah, and it's been a real pleasure presenting to you.
Thank you, everyone.
Thank you, everybody. Goodbye.